Welcome to the RaDAR Info Day. We're going to present here updates from the RaDAR procurements, but taking into account that the final and definite publication will be when the call for tender documentations are published. So, antimicrobial resistance problem. The problem, around 5 million people died from this illness related to antimicrobial resistance. Around 1.3 were direct result of them in 2019. In 2050, more deaths are going to be related to AMR than cancer. And it represents a high economic burden, around 1.5 billion euros, both in healthcare costs and productivity losses in the EU. And the manner in which we treat infections is now endangering our health in the future. So what's the need? To respond to joint action of the antimicrobial resistance, there's an action plan. And it represents improving the early detection systems to ensure the quality care process, screening drug resistance and virulence in terms to improve the treatment effectiveness, and reduce both healthcare costs and governmental costs. Reporting and rapid communication to increase their system's resilience. As we saw in the COVID-19, this is something that could be improved, and it has been highly improved from the experience we had during COVID. And the RaDAR project is also built upon the experience of a pre-commercial procurement, which was called anti-superbugs. And now a new consortium made up of these 4 buyers, represented by RESA, buying for the whole France country, Basque Health Country, Osakidetza in Spain, the Catalan Institute of Technology in Spain, and University of Naples Federico II Public Health Department in Italy. Supporting entities like AQuAS, as coordinators, and other entities are helping these procurers, these buyers, to this procurement of innovation process. So what are the rather value-based buyers procurement group potential for scalability? For one thing, Osakidetza, the Basque Health Service, it's procuring also in terms of not just the hospitals, but the entire region of Gipuzkoa and including the primary care centers. The Catalan Institute of Technology is reference in oncology, and there are other centers, oncology hospitals across Catalonia that are part of ECO. And it's also linked to VINCAT, which is the surveillance and stewardship program of Catalonia. RESA as a central purchasing body buys for entire France. And UNINA, as a Department of Public Health in the University of Naples, also provides services to the entire Campania region. So from needs to the call for tender definition methodology. First, we started with the demand and the needs, defining what is the unmet need, and this verifying that its needs and describing the requirements and the prioritization of them, and defining a business case for each of the buyers. Then we went for the market maturity and feasibility assessment with a state-of-the-art analysis and with open market consultation events. And finally, we have established what is the demand feasibility and viability by defining a challenge brief and introducing the contracts permeable to value and the governance around this process, which will become a public procurement of innovation around other options that we had. So what's the current workflow? First, the suspicion of infection. Here we have some issues like the lack of screening and the difficulties for key data visualization. Second, then we have now the test selection and sample, the sample transfer, sample processing, and the results and diagnosis. And in this entire process, we have complex sample extraction, we have lab-based low diagnostic tests. Specialized personnel is needed to interpret and to do this data. We don't have appropriate broad spectrum antimicrobial use for the treatment. We have difficulties for communication between different stakeholders, also difficulties for key patient data visualization to make the decision of which antibiotic to prescribe. And we have difficulties for stewardship data visualization to be accessible, both local and regionally. And last, we have the treatment decision and control measures and the treatment and patient follow-up here. We have difficulties here on key patient data visualization, difficulties on stewardship data, and difficulties in communication between important stakeholders, which leads to not targeted antimicrobial prescription. And now I'll pass to my colleague, Victoria. Go ahead.
So, as Olman previously mentioned, we performed a market readiness assessment, which include a market sounding, also 5 open market consultation events, one international, and 4 local events that included a total of 164 participants, and also 84 bilateral meetings where 12 countries were represented. Now we will focus on the RaDAR evaluation framework, which has been done following the value-based permeability methodology, which is based in the application of the theory of change, because we are transforming the manner we are providing the health services. Then we can expect a long-term impact from RaDAR-PPI, and we can already think about that. This impact that we will create will have to impact different stakeholders, including patients, also healthcare professionals, healthcare providers, the health system, and also at a socioeconomic level. Once we have defined the impact, we can go backwards and define the mid long-term outcomes and also the outputs, also including the perspective of the different stakeholders. Once we have the results defined, we can therefore define the activities, which are the specific tasks that need to be undertaken in the short term in order to build first the outputs, then the outcomes, and finally the impact. Then here I'm gonna share the RaDAR-PPI results that has been agreed together with the consortium, but it's important to mention that each buyer may focus or may select some areas of the ones that are presented. So the overall impact would be infection prevention, control, and stewardship, and the treatment management appropriateness. As an outcome, we have defined the IMR integrated smart management, including 4 areas: the patient management, the pathogen management, the sample management, and the prescription management. And also, as an output, we have defined the healthcare professional data visualization for pathogen, patient sample and prescription management, and the support for pathogen and on-site management. We have also defined the different activities which can be classified in 4 main areas of intervention, including the MDRO detection, the training and support, the information access, visualization and data aggregation in blue, and the interoperability in red. All the activities will fit the rapid detection and management information system and the on-site and pathogen support system, that both of them will include the health professional communication system and the RaDAR configuration and performance system. Here we can see a RaDAR solution, which is included under the blue figure. So RaDAR solution can collect, retrieve by interoperating, store, process, and visualize data. So it has first a rapid MDRO detection that can include the point of care, but also environmental detection, the digital guidelines and protocols from the different buyers, also the interoperability with the hospital information system, and that can be different and can differ between the buyers. So at in their own videos, they will explain their particularities. And it will form on one side the rapid detection and management information system, and also the on-site and pathogen support system. Both systems will have to include the assessment of the user access and support and maintenance, the radar performance monitoring system, and the communication, as previously mentioned. And different users will be using, will have access to the solution. Once we implement RaDAR to the workflow, so to the in-health healthcare facility, it has an impact. A clear impact on the first step. It will allow the screening of patients and not only the syndromic approach. Moreover, it will also allow a faster detection and to have earlier in time the test results. Overall, allowing a better and informed treatment decision and better and informed control measures. Also, the on-site and pathogen support system will also support to take better and informed control measures related to the on-site. Then at this stage, as we have previously mentioned, each buyer is defining and will explain on their videos their ambition of their contracts. And so therefore they are positioning themselves in the following axes. So from the value that they are expected to generate through the PPI, the risk that they are willing to take through the PPI, and the preparedness available of the envisioned intervention. We understand value as the ability to provide the results that has been previously shared, and also the risk that the chance that the actual results will differ from the expected results. With that in mind, we can understand as a first example that we can have a buyer which may aim to bring or generate higher value. This buyer will probably, with the information we have of the market, they will have less preparedness and evidence already in the market, and they will be facing a higher risk. On the other hand, it may be another buyer which aims to provide the known value, which it will be facing less risk, and obviously they will have more preparedness and evidence. With that, we can say that the first example will have higher innovation levels, but it doesn't mean to be technological innovation. It is linked to the evidence generation, which leads to technological integration, to new relations between the procurer and the economical operator, and new processes. On the other hand, the second example, they will be less ambitious on the innovation level, and it will be mainly related to the technological integration. So finally, we would like to mention that the application of the value-based permeability methodology have support the buyers to determine the expected results that have at the same time help to prepare and to work towards the object of the contract, the requirements, the awarding criteria, the monitoring and the payment schema. And this, during the contract execution, it will be possible to generate evidences. And this will provide new market evidences with the generated evidences that will help to scale up to the market the solutions. So thank you very much for listening us. We invite you to continue reviewing and seeing the videos that each buyer have prepared from their own call for tender.